All right, so today we are doing a little bit of cheek and under eye. As you can see, this patient has a little bit of deficiency here in this mid-face area that we want to try and give him a little bit more support back. If you notice, as I support this mid-face, the under eye appears less deficient. We've done his under eye in the past, but it has been quite some time. So we're going to add just a little bit of a heavy filler into this mid-face area, and then we'll come back and use a cannula and do a little bit in the tear trough as well. I have marked his infraorbital foramen. That is an area, a landmark that, of course, we are concerned with when we're doing any dermal filler placement. And so I have that marked off just to make sure that I stay in an appropriate and safe zone. You can go ahead and close your eyes. Alrighty. So in this area, we're using, as I said, a deep filler or a heavy filler, and we're placing this product deep on bone. As you saw, I aspirated and I slowly am placing product. We want this product placed deep because it will help give us that support that we lose as we age. Of course, you're looking at him thinking he's not very old, but believe it or not, even at his age, he's starting to lose a little bit of bone and just needs a little support there. Okay, open your eye for me and just look straight ahead. So you can see, I feel like even just those 3 little injections helped build up this mid-face a little bit compared to the untreated side. You can appreciate sort of how flat he is in through here versus now he has a little bit of support. So a little bit of product can definitely go a long way. You doing okay?
Mm-hmm.
Okay. So I'm going to go ahead and switch to my cannula. And then we're going to add a little bit here in the tear trough using the same product, so a heavy product that we're going to lay deep. I am going to numb the area with a little bit of lidocaine first, just to make it comfortable for the patient. I'm just measuring at this point, so no pokes yet. So I know where to enter. Okay, so the lidocaine is going to be a little pinchy and a burn. And now I'm going to just use a needle to create an entry point that our cannula can go through. This should be like dull, not sharp. You doing okay?
Mm-hmm.
So now that I've created that entry point, then I can come back with my blunt cannula and sort of slide that cannula into the treatment space, which is the tear trough. So it feels a little bit, I always describe like a cannula as like creepy crawly rather than pain. If you're experiencing any sharp pain though, I want to know about it. So as I'm advancing my cannula, I'm just feeling the tip of my instrument. You should always know where the tip of your instrument is. And again, I'm ensuring that I feel nice and deep because we want to give him deep support, as opposed to a lighter filler, like for example a Bellatero. We lay that a little bit more superficially, like I always say, like frosting. So that's a more superficial product. When we're using a heavier product though, you want that deep. We don't want to be able to see that under the tissue. Always aspirating, of course, and then retrograde injections as we exit. We generally don't like to advance our cannula all the way to the inner canthus. So I like to sort of just take a Q-tip or your finger and just make sure that the product gets up there into the corner of the eye. as well, but we don't like to get up there that close. I'm going to go ahead and just sort of clean him off a little bit so that you can compare one side of the face to the other. Okay, if you can just look straight at the camera for us, you can see how improved that looks. Here he actually has some cheek support. Here he's very, very deficient. And then look how nice his under eye looks. We've filled in that area nicely. One thing to keep in mind for the under eye is it is a pretty finicky area. It can lead to a lot of swelling. And the products that we use can pull a lot of water as well. So rather than fully correcting the patients, I like to do it more of like a stepwise approach. So I treat them and then see them back in 2 weeks. And then if needed, we add more because there's going to be some pulling of water after the procedure because these products are hydrophilic. And so if I filled him to correction today and then that product pulls water, he might appear overfilled in a couple of weeks. And that's obviously the last thing that we would want. So we'll see, we'll sort of go ahead and do his other side and then see him back for follow-up in a couple of weeks to reevaluate.